The minimally invasive surgery is multiple types that avoid the big incisions that we used to do in the abdomen, like abdominal hysterectomies. These days that can be done with something called laparoscopy, where little tiny tubes are put through the belly button and often one or two on either side of the low abdomen. It can also be something called a hysteroscopy, where a small tube is put into the vagina, through the cervix, and into the uterine cavity. It has a camera attached to it so we can see inside the uterus, and sometimes instruments can be put through it to biopsy or remove things that we might see that are abnormal. It seems like a lot of people hear what their friends are having and are wanting to do the exact same thing, but there are a lot of different reasons why a surgeon might choose one approach over another approach to doing a hysterectomy. And so that's something that you really ought to talk to your healthcare provider about. Some of the factors in what we choose can depend on, is there a cancer there? Do we need to do something with ovaries, not just the uterus? Have you had other abdominal surgeries, which like C-sections or other abdominal surgeries like appendectomies, which may cause a lot of scarring and make surgeries more difficult. It can include the size of the uterus if you have fibroids there. So it's one of those things that you'll want to talk to your surgeon about. What are all of the choices available to me of the types of hysterectomy, and why or why not should I be doing that approach? Well, luckily these days we have a lot of choices for treating heavy bleeding, and in fact you don't have to do anything about it if there's no cancer there, if you don't have a really low blood count from the amount of bleeding, and if it's not bothering your life in any way. For women who it's bothering their life, obviously there are a lot of things that we'll want to do to help them. It can include something as simple as a D&C or scraping out the uterine lining, but there are more effective treatments for most women. It can include medication, like birth control pills. There are other medications now available. It can include an IUD, which is a very effective treatment. There are a few circumstances where robotic surgery is proven to be better than other methods, and those are primarily the types of surgery that would have to be done as full open surgeries if you didn't use a robot. The majority of surgeries can be done with a laparoscopy instead of with a robot. Robots are very expensive, requires additional training, and in most circumstances is not proven to be safer. But there are a few types of surgery where, such as cancer surgery or really severe endometriosis type surgeries, or surgeries where somebody's had a lot of abdominal surgery in the past and there's a lot of scarring, where being able to work with a robot makes a big difference. It's been fantastic for me to see over the course of my 20-plus year career, seeing more and more surgeries be done minimally invasive ways instead of the open abdominal way. Certainly women are much happier with the results, have much less pain, which is very important, and are able to return to work and normal activity much faster.